Welcome to the presentation, Food and Your Mood, How Nutrition Impacts Your Mental Well-Being. I am the presenter, Dr. Vanessa Ruiz. I am a naturopathic doctor and I'm a nurse specializing in mental health. I am a naturopathic physician and I practice in Scottsdale, Arizona. My website is listed there, and I'm also the founder of Nurses for Natural Health. Our mission is to empower nurses in education about natural medicine, in empowering them as healers, and also encouraging them in self-care. The materials that are included in this course could include interventions and modalities that may be beyond the authorized practice of mental health professionals or nurses. It's important that you know your scope of practice and you abide by the scope of practice as defined in law. So what are the causes of mental health issues? Oftentimes we've kind of blamed this idea of the neurotransmitter imbalance. If you have low serotonin, it's likely to lead to depression and anxiety. If you have ADD, ADHD, it's likely you have low dopamine, norepinephrine levels. Those are neurotransmitters that are involved in concentration and focus. If you have OCD, panic attacks, and psychosis, it's likely that you may have too much dopamine, too much norepinephrine, and that may be what's the underlying cause of the OCD. However, it's not that easy. It's not just a neurotransmitter imbalance issue, because there are certain types of depression that actually have high serotonin levels. And there are also medications that can increase or decrease the level of these neurotransmitters at the synapses. And if you were to try to induce depletion of serotonin, it doesn't necessarily make the individuals depressed. And if it were an issue of just increasing neurotransmitters, then why don't patients feel better in the first few days after initiating medications? When patients have hypertension, they take the blood pressure medication, and within hours, within days, they'll have low blood pressure. But it's not the case with some of these psychotropic medications. So what is at play? And what really helps lift mood? Studies have shown that it's actually more about neurogenesis and neuroplasticity. Neurogenesis is the creation of neurons, and neuroplasticity is the reorganization of the brain. When there's neurogenesis and neuroplasticity, that's actually what can follow is actually improved mood. So what are these things that can constitute neuroplasticity? Having a healthy brain, for example. People who have been exposed to blunt injury to the brain, traumatic brain injuries, they often have a lot of inflammation occurring. And the inflammation is really more of a degenerative state versus neurogenesis. Having novelty, having humor in your life, relationships, nutrition, very good nutrition can help with neuroplasticity. Exercise, especially creating novel movements, sleep, and the practice and the close paying of attention. This is what encompasses neuroplasticity. There are also other determinants of mental health, and for this, we're only going to be focusing on nutrition. There's genetics, there's heavy metal toxicity, because the heavy metals can be very oxidative to the brain and very inflammatory. There's trauma and adverse childhood experiences and events. There are also hormonal imbalances. Estrogen, for example, helps to regulate the neurotransmitters. There's also the immune system, and there's so many determinants of mental health. So just considering that it's a neurotransmitter imbalance, you're not able to see the full breadth and scope of what may be the underlying cause. As I said before, we're going to focus on nutrition, and there's actually a growing field called nutritional psychology, which looks at the relationship of diet quality and mental illness. And this relationship may be due to the biochemical pathways of inflammation, oxidative stress, the imbalance in the bacteria of the gut, neurotrophic factors, these are brain growth factors, that may be at the underlying cause, the relationship between poor diet quality and common mental illnesses. Take, for example, the relationship of fat. Most of our brain is actually composed of fat. And so having good quality of fat would translate to having a good quality of neuronal membranes, and good vitamin consumption actually can translate to aiding the body's ability to be able to make neurotransmitters. Let's talk about some of the neurotransmitters. We have glutamate. Glutamate is typically an excitatory neurotransmitter, meaning that it helps to signal, it helps it turn on the brain. And GABA and glycine, these are more calming neurotransmitters. Oftentimes when people have insomnia, there are supplements we can give that can help to increase the GABA in the brain. Glutamate, GABA, glycine, these all work in synergy with one another. We also have other neurotransmitters. So while in the brain we can call them neurotransmitters, but they also have functions in other parts of the body. Dopamine is associated with concentration, focus, and it's typically an excitatory neurotransmitter. It is also helpful with movement. When patients have Parkinson's, dopamine is something that we're trying to increase in their body to help with the movement. Norepinephrine is involved in the stress response in the brain. It helps with arousal. It also helps with concentration. And in the body, it helps to regulate blood sugar. Serotonin is known as the happy chemical, and it's involved in digestion, in gastric motility, as well as in libido. Now, this is a very simplistic way of looking at the neurotransmitters, and the functions are not an exhaustive list. Okay? So let's look at how serotonin and the other neurotransmitters are made. So what you see in the very top is tryptophan. Tryptophan gets converted into the very popular supplement 5-HTP, and then after that serotonin. And what you'll notice is that there's vitamins that are actually required for this biochemical process to move forward. Tryptophan, by the way, is a protein that can be found in a lot of animal products. One that we know of very well is turkey. Turkey makes you sleepy, and that's because serotonin and melatonin is actually at the very end of this pathway. So the conversion of tryptophan to serotonin actually requires some of the B vitamins, folate, zinc, magnesium, D3, vitamin C. It also will require iron as well. It's just not included in this picture. You look in the very bottom, this is the production of dopamine and noradrenaline, or norepinephrine. What you'll find is tyrosine is an amino acid that you can find it in eggs, you can find it also in animal products, as well as in certain other foods. And it requires also some of the B vitamins, iron, magnesium, vitamin C, and copper to help move this biochemical process forward. What you will also note between these two is that they require similar vitamins. So if you're low on magnesium, if you're not having adequate vitamin C in your diet, or if you're not having enough iron, then it's likely that both these pathways are going to be compromised. And it's not just these pathways that require these vitamins. There are also other pathways, hormone production, for example. Thyroid hormone will require zinc. And in addition, magnesium is involved in over 350 different chemical reactions in the body. So a diet low in magnesium, you're likely compromising other biochemical pathways. I hope that this kind of shows how important vitamins are for your mental health. Other determinants of mental health and nutrition is the microbiome. Microbiome is what we call the gut bacteria. They've done studies where if you manipulate the gut flora in rats, you can actually change their behavior. A rat that typically has more aggressive tendencies, when given bacteria from a rat that was bred for more timid tendencies, you'll notice that with the inoculation, the aggressive rat takes on some of the behaviors of the more timid rat. There's also been research studies that show that the gut microbiome, it helps to regulate and develop the stress response system. What about in humans? In this particular study, adding lactobacillus may actually help with postpartum depression and anxiety. So the bacteria in our guts, they help to create beneficial products like short-chain fatty acids, or they can create products that lend itself to more inflammation in the gut. Other ways to see the relationship of how food can affect your mood is through other diseases like celiac disease. There's usually concomitants of depression, irritable bowel syndrome. Typically the patients that I see, they have anxiety. The anxiety, they anticipate some kind of event, and then they have either diarrhea or they have constipation. Okay. And consuming foods that have little nutritional value actually affects the brain in the sense of you can actually see reductions in the volume of the hippocampus. The hippocampus is a part of your brain that helps with spatial regulation. It also helps with emotional ability. And so this is an area of the brain that's particularly important in the fight or flight system. So you really don't want to be compromising it and reducing its volume. Diabetics, when their blood sugars have improved, they've reported having better mood as well. And we'll look at the relationship between food and low blood sugar and stress a little later. Having inflammation can influence certain neurochemicals. So for example, low-lying inflammation can affect norepinephrine and dopamine, as inflammation is a sign of danger to the body. Inflammation can also trigger poor energy production. So a lot of my patients that are depressed, they end up having low energy. Inflammation also impacts cortisol levels. So think about the most anti-inflammatory hormone. When a patient has joint pain or low back pain, one of the very first things that we can give them is giving them a cortisone shot to help with that inflammation and pain. So having inflammation, cortisol levels are going to be impacted. What about low blood sugar? Low blood sugar can lead to decreased attention span, poor ability to regulate your emotions, poor ability to cope with stress. And there are also research studies that show that willpower is not necessarily the equivalent of having moral fortitude. It may actually be linked to blood sugar levels. And think of it this way. When you have low blood sugars, one of the first things that you can start to feel is shaky. You can start to feel this hangriness, so hungry and angry at the same time, because that's actually an evolutionary mechanism to engage behaviors in that organism. So think about it this way. If you're hangry, you're very irritable, you want to kill something so then you can eat it, right? And that hangriness is actually a stress response. It's more of an adrenaline response. And when you've eaten a meal, a lot of people say that they feel relaxed, they feel almost sleepy. That's because when you're eating a meal with carbohydrates, that helps tryptophan get absorbed, and then that gets converted into serotonin, and then the brain gets this signal that everything is okay. What about dehydration? How does it affect the body and the brain? So in the brain, it can affect your memory, concentration, ability to problem solve, and also your attention. And this is seen in just very small levels of dehydration. So 2% loss of water. That's basically someone working out for an hour in 80-degree weather, and you've probably likely lost several pounds of water. Okay? The effect on the body, there's already loss of sodium and electrolytes. And there's also release of cortisol and adrenaline because these help to regulate the water balance. Well, how does adrenaline affect our mental health? Adrenaline signals to the hippocampus, we see that again, and the amygdala, that's a lizard part of our brain. It turns on that tunnel vision, and it also turns on the default patterns. It cuts off the ability to be able to think clearly. That's why a lot of people say, oh, I have brain fog. It also cuts off the ability to reason, logic, executive functioning, all these things that when you're approached with a new situation you'll need. So when you are performing in tasks that require higher cognitive functioning, you're gonna want to make sure you're eating enough, and you're also going to want to make sure that you're not dehydrated because you're going to be impacting your ability to perform. Okay. So what do we do then? So at every meal, make sure that it's a very well-rounded meal with a protein, carb, and fat. And make sure that it's adequate portion sizes. So a lot of us don't walk around with a weighing scale or measuring cups in our purse or bag. So what I tell my patients is that the amount of fat you should be eating is probably the size of half the size of your thumb. So basically at the first joint of your thumb. Then for carbohydrate, so that would include like a grain, rice, or pasta, you want the size of a cupped palm. Okay, that would be one serving. And then for the protein, that could be beans, that could be a piece of chicken. Essentially, it's going to be the size of a flattened palm. Okay. And then also because when you have blood sugar dips, you're going to be engaging your stress response. You want to make sure that you have good levels of blood sugar. So consuming protein every 3 hours. So things like hummus, things like trail mix with fruit, that can help to minimize kind of that crash and then that subsequent adrenaline release. So what are the things that we can do to assess a patient's nutrition, to assess the microbiome, to assess what's going on in their gut? These are some of the testings that I do. The first one is a food sensitivity testing, because I've often seen that when the food doesn't jive well with their biochemistry, it can lead to inflammation. So, and oftentimes there are foods that customarily will increase inflammation, so that'll be added sugar, that could be saturated fats. However, sometimes it's not that clear cut. Like for example, this patient, they were sensitive to green peas and they were sensitive to black tea. That's very random. I wouldn't think off the top of my head. And so it requires sometimes a much more direct and focused approach. They would have to eliminate the foods in red for at least 30 to 60 days, but it's really dependent upon the sensitivity of that patient. I've seen patients with panic attacks have a lot more sensitivity to their environment and also to the foods that they're consuming. Other ways to be able to see what's going on, neurotransmitter metabolite testing. So that kind of gives us an idea of, is this patient having inadequate levels of the neurotransmitters? Are they in good ratios? And it looks at more the metabolites than the actual neurotransmitters. And what about what's going on in the gut? So with this one, we're looking at this patient's yeast and fungal markers. And so it can give us an idea of what's actually in the gut. Is there a lot of yeast? Is there a lot of bad bacteria? Bad bacteria would be something like Clostridia, which is which can cause issues with norepinephrine and dopamine production. Okay. What are some beneficial diets for patients that you'd recommend? So the anti-inflammatory diet is a great diet to start with. And with the diets, it's more of a conversation of helping my patient to recognize that whatever food they're eating is going to affect their mood. And so oftentimes it's about starting somewhere, because that diet ultimately ends up evolving, and it's not going to be something that they're on for the rest of their life. Once they've made that connection that food is going to affect their mood, it's a very powerful ally in getting them to initiate their own sense of what's the best diet for them. The anti-inflammatory diet helps to increase foods that are anti-inflammatory and decrease foods that can be triggering inflammation, like sugar, saturated fat, and certain other kinds of fats. Okay. They may also engage in an elimination diet. We try for 1 month, eliminating the most common food allergens or food sensitivities like gluten, wheat, corn, soy, eggs, and dairy. And then there's also other diets like the Mediterranean diet, which can be very beneficial in Alzheimer's, cardiovascular disease. And these diets are not an exhaustive list. There are other diets that I end up recommending, like the low FODMAP diet, especially if they have a lot of GI symptoms. And so it really is more of a personalized approach. Other nutritional strategies I engage my patients with: a 3-day diet diary helps me to kind of see what their pattern is. 24-hour diet recall is not usually that accurate. However, it gives you an idea of what foods the patient thinks is actually beneficial or good nutritious foods. Doing mindfulness while eating. This can be helpful because it helps the patient get into a relaxed state so they can actually absorb better. Ensure that they're eating whole, non-processed foods, consuming beneficial fats like coconut oils, and adding some kind of fermented food to help support their GI tract. Also making sure that the food that they're consuming has a lot of fiber, because that way they can actually help feed the bacteria that's in their guts. Hydration is important, as we mentioned earlier, and consuming foods that are antioxidants. So turmeric, olive oil, and also chocolate. Chocolate has a lot of antioxidants in it. Okay. So what does this look like how does nutrition fit into a treatment plan? So I had a patient in her 30s with OCD and dermatillomania. So essentially she was picking her skin over 40 times a day. And one of her biggest issues was not even the picking, it was really her frustration and the impulse and inability to be able to stop. At our first treatment, we did some food sensitivity testing, discovered that she had a lot of food sensitivities and a lot of inflammation. Proceeded with an elimination diet as well as supplementation. And then her follow-up, she went from over 40 times a day to less than 4. Pretty big jump. I had another male in his 20s diagnosed with OCD, social anxiety, and we discovered that he had a genetic polymorphism. So essentially he was not able to use folate. As I mentioned earlier, folate is really important in both those pathways of being able to produce serotonin as well as dopamine and norepinephrine. And so it really compromised his neurotransmitter production. We started him on folate replacement, and within several weeks he mentioned improvement in his anxiety. He was able to even tell when he needed to redose again with folate, because his anxiety would then start to creep up. And then he started to acquire some of the functioning that he had lost, like the ability to drive. So if this has all been interesting for you, approaching mental health in a holistic way, please, I offer a daily mental health checklist, so please email if you're interested in that. They're essentially the 8 things that I engage my patients with to address mental well-being. I also have other programs available, like the 7-Day Detox Program, the Heal My Gut program, as well as the Reset Anxiety, Reset Depression programs. I am coming out with a 21-day holistic workbook that's coming out in May 15th. And you can email me at info@enlivenmentalhealth if you'd like to have that mental wellness workbook. These are some of the resources that I've used in this talk, and I've also helped kind of guide me in developing this more holistic approach. And if you have any questions, please contact me at info@enlivenmentalhealth.com or on my telephone 480-426-8040.